Hello, and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. Many times on this program you hear us speak about health, wellness, fitness, exercise. And I say hear us speaking about it because you probably will always hear us speaking about and encouraging the importance of fitness and being well. An upcoming event that encourages this just as well is the 10-Man Roar. However, there are some slight complications that athletes themselves sometimes have to deal with. We'd like to share both perspectives with you this evening, the good consequences of exercise and fitness and some genetic disorders that athletes sometimes need to be aware of. We have with us Dr. Rory Coutinho, as well as one of the organizers of 10-Man Roar, Andre Simon. Let's get their perspective on these issues. Thanks for joining us again. As we said at the outset, we're talking about the 10-Man Roar, and you hear a lot about it, but what exactly is it? How did it begin? Where did it start? Who are the affiliates? Today we have with us Andre Simon, correct, as well as Dr. Coutinho. And Andre, from my understanding in our initial discussions, you're one of the original founders behind the 10-Man Roar. Can you give us a little idea, some of the background, how it started, how it came about, how you connected with AUA?
Right. Well, like I was saying earlier, the 10-Man Roar actually started between myself and Rory Butler, along with Jonathan, the late Jonathan Roar. You know, we came up and we decided, okay, look, we need to do a big triathlon event in Antigua. But before that, how we met Jonathan, we actually used to see, you know, because we used to train just outside AUA along the stretch here, and we used to see this white guy just running in the morning, early mornings. Right. You know, before we would even start, he'd be already out on the road. And we approached him eventually and we said, okay, look, you know, what's up, what you up to, you know, what are you doing, you know, and he told us, you know, he's a triathlete and he's a student of the American University. And, you know, in so talking, you know, eventually we decided, okay, look, we come up with this big event in Antigua, you know, the first of its kind, and that's how we came up with the 10-Man Roar.
Why did you think that there was such a need for this type of activity for a 10-man to be done here in Antigua?
Well, you know, in terms of sports tourism, it's a big thing for sports tourism. I mean, if you look at Ironmans around the world, you know, it's making headways across the world, Ironman. And, you know, we said, okay, look, it's a beautiful destination, the Caribbean. You know, speaking with Jonathan himself, he was actually one of the persons that wanted to push it because he was like, you know, triathlons that he's accustomed to, it's sort of in lakes and ponds, okay. You know, and the waters aren't as clear. You know, that would be the first thing that we can promote, you know, the beaches. You know, a lot of athletes would want to come here just for the swim, you know, and after that we can just push the bike, push the run, you know. So Jonathan was really instrumental in saying, okay, look, let's get this going, you know, it's possible, and that's what we did.
Now, the name of the program is Healthy Perspectives, so I have to ask you this question. You know, we talk about tourism and athletes. Right. I hope there's a health component as to why you felt the need to develop something like this. Well,
you know, of course, triathletes are the most, the fittest set of people in the world. And, you know, we thought, you know, triathlon, it's not going to reach one sport, it can reach up to 3 sports, well 4 if you include triathlon. Right. So we can target the runners, we can target the cyclists, we can target the swimmers, right? And we said, look, if we can't get, because of course it's a huge task. I mean, the swim alone is 1.2, because it's the half iron distance. It's a 1.2 mile swim, 56 mile bike, and a 13.1 mile run, or a half marathon. And if you look at a lot of persons here on the island, they don't really train for those sort of distances. So we said, okay, look, we might not get as many individuals to compete in the race. However, we can target the runners, we can target the cyclists, we can target the swimmers, and for the first time bring all these top athletes together to do one big event.
Does it take a special kind of person, a special kind of athlete to be able to pull this off?
Well, this year we have a few newcomers, but it's something that you have to train for. I wouldn't recommend for anyone to just get up and do a half Ironman or an Ironman. It's something that you really have to train for. I mean, internationally there's cut-off times for each segment. So if you're over that time, actually, you get pulled out of the race.
Okay.
So it's something that you actually have to prepare for. But this year we've actually decided to throw in the 5K run and walk, and that would cater to, you know, our sponsors, you know, the corporate community, you know, persons that just want to keep fit, stay healthy. So we have that 5K segment added to it. And we also have the try, which is a much shorter distance of the actual big distance, which I just discussed a while ago.
Okay.
Right. So for persons who are now starting for the first time, they can go into that short distance and then, eventually build, and then maybe next year they can take part in the big distance.
How long have you been doing this?
Well, I actually stopped triathlon as of last year. Actually, I'm actually doing cycling full time.
Okay.
Right. So I'm focusing on that. But I've been doing triathlon since 2009. And I mean, I have to say it's a sport that I love, but time-wise, because I work, it's hard for me to work and still train. So the cycling allows me, I have more, my time is more flexible, right? So I get to put in the hours that I need.
As the sport, as it pertains to the sport and timing, it's almost as if it is a job in itself to be able to train for this type of event.
Yes. Triathlon, half Ironman distance, and Ironman, it's a huge task. I mean, you're talking about anywhere in the region of 3 hours to anything over 8 hours. Some people take up to, for the full distance, persons take up to 16 hours to complete it. 16, 18, 20 hours, some people, but there, of course, there's a cutoff. So, I mean, it's something that you really have to dedicate yourself to and realize, okay, look, you're going to train hard for this and you're going to do it.
You mentioned the name Jonathan Rohr a couple of times. You mentioned the late Jonathan Rohr.
Right.
For our viewers who may not be aware, what happened to Jonathan?
Well, he died, one morning we just got a phone call that, hey, Jonathan just died, and we were really surprised, but we learned to find out that it was a condition, myopathy, right. It came as a shock to a lot of us because he was a person that, he was always on the go. If you had a word with some of his roommates, they were like, Jonathan would be the first up in the morning, and he was always ready to go, So it came as a huge surprise for us.
Which leads me to ask, if you guys did you have an opportunity to actually train with him?
Yes, Jonathan trained with us. We trained at least 3 times a week together because, I mean, triathlon, again, most times you'd find because of, Jonathan, he went to school here, I worked, Rory worked as well, so our working hours sometimes wasn't flexible enough for all of us to train together. So sometimes, we'd be doing training by ourselves, but at least 3 times a week we trained together. So, and funny you should say, actually the morning before he died, we actually trained together just the morning before. So the next morning when I heard it, and I was supposed to go to, I think, Montserrat the next day. I had to change that because it was a huge shock for me.
I understand.
Right.
In training with him, did you all pick up on anything? That was his game off? Was he sluggish?
Jonathan was always stronger than Rory and myself. Like I said, he had a lot of experience. He did a lot of international races. I think he came 3rd in the U.S. National trials one year. So he was really, really good. One thing I noticed though, like in training, like especially swimming, he would always make a wheezing noise, like swimming in the, because when he came up to breathe, you'd actually hear that. And sometimes I'd ask him, hey John, what's that? He said, well, it's something natural. That's something that he naturally does. So I don't know if that was associated with it, but he always used to make this wheezing noise. But outside of that, I mean, Jonathan was very, very strong.
And which is the interesting thing then, because for it to be so sudden,
right.
It leads your mind to wonder, hey, did we miss something? Should something have been picked up?
Exactly.
Was he exhibiting some signs?
Exactly.
Which leads us to you, Dr. Coutinho. We have to take a quick break though, but after the break, I'd like to find out from you if you can give us some information on this disorder and what persons may need to look forward to.
Sure will.
Stay with us, we'll be right back. Thanks for coming back. If you're just joining us, we've been talking about the Tin Man Roar event that's coming up soon, but also trying to get some background information on why it started. We have with us Mr. Andre Simon as well as Dr. Ronnie Coutinho. Before the break, Andre was giving us the background and he mentioned this disorder that Jonathan eventually died with. Can you explain it to us, please?
Sure, it's called a cardiomyopathy. There are types of cardiomyopathy, but I think what our colleague here referred to is what we call a hypertrophic cardiomyopathy, which many young people get, especially between 20 to 40 years of age. And one of the symptoms or manifestations that was mentioned is classical of hypertrophic cardiomyopathy, where you get a difficulty in breathing.
Okay.
Certainly it was explained as wheezing, but that's what it is. It's exercise intolerance that's manifested sometimes as a difficulty in breathing.
Because it's manifested in that way, is it many times confused with being something else? Or could it be confused with being something else?
Absolutely, it's confused. I mean, cardiac manifestations and respiratory manifestations are multiple. They're very variable also. So the fact that he had this breathing problem, he probably attributed it to something else rather than a heart problem.
Mm-hmm.
And that's what underlies cardiomyopathy. Not many people realize, not many young athletes realize that they could be having a cardiomyopathy.
And you use the word athletes consistently. Is it a problem that's many times seen in athletes, or is it something that you and I, the wannabe athletes, may actually have to contend with?
Good question. Hypertrophic cardiomyopathy is extremely rare. In fact, there are about 400,000 cases in the United States of heart disease, but it's mainly coronary artery disease. Just about 5% are cardiomyopathies, and hypertrophic is one of the rarer forms of cardiomyopathy. It does occur in athletes because, at times they train, but we have to distinguish it between what we call an athlete's heart and a hypertrophic cardiomyopathy. An athlete's heart is more physiological. It's due to the intense training that many athletes undergo, and I'm sure Jonathan was one of them. But unfortunately, we did pick it up as an athlete's heart.
Okay.
So very often when they come with these manifestations, an athlete who trains very intensely, we do a pre-screening in today's world, especially in Europe, where we would recommend them to go for an echocardiogram.
Okay.
That will really show us what the heart looks like, whether the muscle of the heart is enlarged or whether it's normal. But enlargement of the heart does not make a cardiomyopathy alone, because you can get that in an athlete's heart.
Okay.
What makes a cardiomyopathy is that it's pathological. It impedes what we call the ventricles, where the heart's filled with blood. So you don't get enough of blood, so that blood cannot be pumped out because it becomes extremely narrow. And as it is being pumped out through that narrow orifice, extremely narrow, it just cannot meet the demands of the myocardium, of the heart muscle.
Mm-hmm.
So he faints. In fact, syncope is one of the cardinal manifestations of hypertrophic cardiomyopathy. And he'll get dyspnea because of the filling of the ventricles is impeded and some other manifestations.
Was that something you may have picked up with Jonathan? Did he ever have episodes of fainting or anything like that?
No, I never saw him faint. I never saw that. It was just the breathing, the wheezing.
So if a patient, an athlete, doesn't exhibit any of those signs, how is it caught? You said the echocardiogram, and can you explain to our viewers exactly what an echocardiogram does?
Sure, an echocardiogram is an ultrasound, which we are more familiar with.
Right.
But you use sound waves to detect what goes on in the heart. You can see the muscles of the heart. Importantly, you can also see the vessels of the heart. So it helps us out in that respect.
And would the echocardiogram then, are we saying that would help to determine? But
sure.
If a patient is not exhibiting the signs, how does he know to go get the echocardiogram?
And that's an extremely good question. And I think that's what undermines the meaning of a cardiomyopathy. The fact that young athletes do not recognize it. They don't have manifestations, so they don't go through all this. That's the reason why there's a lot of controversy about pre-screening. Should an athlete go through all the pre-screening, the echocardiogram, the EKGs, which will at least put us in the ballpark. Does this person have a pathology rather than is it physiological? So that's what is important. When we miss out on that, at times, unfortunately, what happens is what we call sudden cardiac death.
Right. And
in fact, sudden cardiac death, like we saw in Jonathan, usually after activity, but maybe not after activity, unfortunately is a manifestation of a hypertrophic cardiomyopathy.
Is that why we generally have the disclaimer, speak to your physician before beginning this particular exercise regime. So as a triathlete, should it be? If it's not, and you correct me, are there officials out there that are saying as a triathlete, you must have this physical done, you must have a complete workup done?
Well, it isn't so stringent. What we do is there's a disclaimer, like you said, and I mean the onus is on the individual if they want to actually go to a physician. But once you sign that disclaimer, it's at your own discretion that you compete in the race.
As far as the officials that then regulate the competitions and so forth, is there, I won't necessarily say legislation, but how do they enforce it? Or is it, there is no enforcement?
There's no enforcement. Basically, once you sign that waiver, like I said, you're at
your life is in your own hands.
It's up to you.
So then that just leads to a further complication that things may in fact be missed.
It does. Talking about pre-screening, as you so well said, Vernon, it's controversial. The American Heart Association has not come out in favor of it. But certainly in Europe, they did a lot of studies, especially in Italy, where most of these athletes have to go through this pre-screening.
Right.
And they found it has reduced the incidence of sudden cardiac death in athletes by 82%.
That's outstanding.
So it is. Though it's rare, I mean, even if we save a few, one of our two athletes' lives, it will really be worth it, I think.
Because of the nature of the disorder, then, you can look at family history, whether anyone else in the family, and in saying that, are we then saying that it's a genetic disorder?
You couldn't have picked up on a more important point. It is genetic. In fact, they say almost 100% of the cases are genetic. And we heard about the physical examination, which may or may not pick it up early because you need a murmur to kind of detect what it is. It's on the left lower sternal border. Murmurs can be at any place, so we may not particularly think it's a hypertrophic cardiomyopathy. But if there's a family history, and it is what is called autosomal dominant in nature, a parent, just one of the two parents, just one having it can pass it on to their kids, because it's supposed to be what we call quote-unquote autosomal dominant in nature. So family history is most important. In fact, the risk of sudden cardiac death in these patients is strengthened by the fact if any of their family members had it. So we can extend that to the siblings, etc.
Okay.
Right.
And although the physical exam, that's where the history is going to come into play.
Very important.
And if a detailed history then for the individual or for the athlete is in fact not done, then a lot of things may then be missed.
Surely. It's one of the points really worth considering strongly.
Something we need
taking a family history.
We need to look into that more. We need to take another quick break. We'll be right back. Welcome back. We're continuing our discussion again with regards to Tin Man. Andre, because of the controversy about getting the exams prior to and just the things that athletes have to go through, and I know this may be a personal question, but what do you think? Do you think it's something that looking at Jonathan's case, he was someone close to you that you would recommend that athletes have these checks done?
Because it happened so close to me. I mean, before that, me personally, I wouldn't even think about going and get myself checked or tell anyone for that matter, hey, I think you should go and get yourself checked out. But seeing how sudden it happened in the case of Jonathan, I would recommend that, anyone taking sports seriously, go and do a full checkup, get everything tested, everything screened, and make sure you're okay before you start taking on any serious training.
Yeah, and because Dr. Coutinho, and I asked that question, previously you were talking about the heart and really what sudden cardiac is, as well as the myopathies. I know this is not an anatomy or physiology lesson, but can you give our viewers sort of a breakdown on the heart real quick and why something like this would happen to the heart? It seems, I won't say simple in explanation, that not enough blood gets into the heart and then something like this, or the walls thicken. but can you give us a general idea of what the heart looks like? And we can show our viewers, but talk them through it if you would.
Surely. The heart in a normal male weighs about 300 to 350 grams. In a female, it's slightly less. It's about 250 grams maximum. It has 3 layers. The layer that's concerned with the pumping of the heart is the myocardium. And that's what we're really talking about here. The pathology of the myocardium, of the muscle of the heart, is involved in this disorder, and it's called a cardiomyopathy. Essentially, the left ventricle, so we have 2 ventricles, the right and the left ventricle. The left ventricle is responsible for for pumping the heart to all the parts of the body. When one of its walls thickens, the cavity gets to be much less. But in hypertrophic cardiomyopathy, it's not only the left ventricle which thickens like it does in an athlete's heart, but it's the bridge between the left and the right ventricles called the septum which thickens. And that really is the problem. And it thickens what is called asymmetrically, not proportionately. In fact, this was famously called ASH, asymmetric septal hypertrophy. So the heart is reduced really like to a small little banana. All that blood that should be in the ventricle is like in a small banana. And that has to be pushed through the orifice to all the parts of the body. So there's a lot of demand which cannot be met, especially in an athlete. And that's the reason why he would get giddy, why he would get dizzy, why he would get dyspnea, etc., with all its complications.
It's a serious strain that's being put on the heart.
In certain centers, they do what is called a myomectomy, where they go into this septum and try and cut out part of the heart. It's not done very often, but that's really one of the things that may be done in a patient who really is at high risk.
I was going to ask that. We didn't even discuss that. What are some of the treatment options if it's identified? Because it seems as if it's missed more than it's identified.
Exactly. If a patient is not at high risk, we try to be as as far as therapy goes, to get rid of the symptoms. So if a person's heart rate is high, that happens in hypertrophic cardiomyopathy, we give them what is called a beta blocker. Then to increase the filling of the blood, we can give them a calcium blocker. It increases filling of the ventricles and the time, gives it a more time where it can be filled. So those who are not at high risk. In very high risk patients, we spoke about a myomectomy, which is really surgical in nature. But they have what is called an ICD. It's called an implantable cardioverter defibrillator, which they put into patients with very high risk. And also this goes with the basic things where we tell them to avoid exercise, to avoid strenuous exercises, etc. I mean, it's really not the best thing in the world to tell an athlete to stop doing what he really likes to do, but at times we have to do it.
How would you feel if someone told you that you couldn't?
Well, if it was a life and death situation, I wouldn't stop altogether, but because I mean, at the end of the day, it's something that you wake up and you think about.
Right.
I mean, just like you think about food.
Absolutely.
I mean, if you seriously love a sport, you wake up and the first thing you're like, okay, yeah, I need to get out now, And sometimes if you, let's say for instance, if I have to work in the morning, when I come home, I'm just itching to go outside and train, So I mean, again, for you to tell an athlete, look, stop doing this altogether, I don't think, as long as they're serious about it, I think that's very, very hard. But again, if I knew it was a life and death situation, I would take certain measures to sort of decrease that strenuous, those strenuous workouts and just limit it to maybe, easy rides or, just.
And your point is so well taken, because sometimes we tend to take a cautionary note to the extent that we maybe overdiagnose it.
Yeah.
So that's also, and we tell them to withdraw from sports, him or her. So.
Which, and this is probably a note for our viewers to really pay attention. We're not telling people not to go and exercise.
Not at all. Not at all.
And this is more raising awareness to this particular disease, because how many people do you actually, would you say, suffer from this?
The prevalence is 1 in 500, so 0.2 to 0.5 maximum. So please, we're just trying to be cautious
Be
here
aware of it.
and be aware of it, and this is all what it's all about.
Because even in our society, because it's genetic, it's not to say it's a black or white thing. Race, is it found in any race?
No, epidemiologically it's found in every race.
Exactly.
In every race.
Male or female,
Both equal, right?
The genetics ultimately are going to play
That's
the
correct.
factor as the path in which it
That's
goes.
correct. And I think genetic testing is becoming the basis of quote-unquote diagnosis of this disorder. It is being offered in certain universities in Western countries.
How
So,
expensive is that?
From what I read, it's not very expensive. In fact, we start with the premise that it's going to be extremely expensive.
Right.
But it's not very expensive,
Okay.
and hopefully we could have.
And I guess it's like all technology these days. When it first starts, it's extremely expensive, and
That's
then
correct.
things begin
Absolutely.
to work their way down.
Right.
Well, thank you very much. Gentlemen, it's been an interesting discussion.
Thank
It's
you.
been enlightening, both from the athlete's perspective as well as the medical perspective. We always like to extend to our guests, hopefully this will not be your last time here on Healthy Perspectives.
Sure, we'd like to come
Dr. Coutinho, you're
Thank
part of the
you.
family here at AUA. I'm sure we'll be seeing
Absolutely.
more of you. And Andre, you're always welcome here, so please know.
And I really want to commend you and certainly our institution for having something in memory of this young athlete. That's really commendable.
It is, it is.
Absolutely.
And after our break, we do have to take our final break, but we'll give you additional information about the upcoming event and how you can find out how, I presume if people want to involve themselves,
Right,
how they can in fact register for it. Stay with us, we'll be right back. So if you could give us some additional information about the 10-man event so that our viewers, they'll know where they need to go, maybe registration points, dates.
Okay, well, registration is still ongoing. The event is actually the 22nd of September at the Darkwood Beach. It starts at 7 a.m. sharp. Like I said, registration is ongoing. You can either register online at AntiguaTinmanTriathlon.com, or you can register at the Olympic office on Redcliffe Street and Redcliffe and Market Street. If you want a phone number, you can contact myself, Andrea Simon, at 720-8239, or Rory Butler at 720-6492. Again, you can register online at AntiguaTinmanTriathlon.com or at the Olympic office on Redcliffe Street.
And we'll put our email and web address up as well, so that any viewers who want to contact us, we'll put them in direct contact with you.
All right.
All right? Take care of yourselves. Thank you for allowing us to spend time with you this evening and for sharing healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.